Special report, Pentagon ran secret anti-vax campaign to undermine China during pandemic. The U.S. military launched a clandestine program amid the COVID crisis to discredit China's Sinovac inoculation, payback for Beijing's efforts to blame Washington for the pandemic. One target, the Filipino public. Health experts say the gambit was indefensible and put innocent lives at risk. At the height of the COVID-19 pandemic, the U.S. military launched a secret campaign to counter what it perceived as China's growing influence in the Philippines, a nation hit especially hard by the deadly virus. The clandestine operation has not been previously reported. It aimed to sow doubt about the safety and efficacy of vaccines and other life-saving aid that was being supplied by China, a Reuters investigation found. Through phony internet accounts meant to impersonate Filipinos, the military's propaganda efforts morphed into an anti-vax campaign. Social media posts decried the quality of face masks, test kits, and the first vaccine that would become available in the Philippines, China's Sinovac inoculation. Reuters identified at least 300 accounts on X, formerly Twitter, that matched descriptions shared by former U.S. military officials familiar with the Philippines operation. Almost all COVID came from China, and the vaccine also came from China. Don't trust China, one typical tweet from July 2020 read in Tagalog. The words were next to a photo of a syringe beside a Chinese flag and a soaring chart of infections. Another post read, from China, PPE, face mask, vaccine, fake, but the coronavirus is real. After Reuters asked X about the accounts, the social media company removed the profiles, determining they were part of a coordinated bot campaign based on activity patterns and internal data. The U.S. military's anti-vax effort began in the spring of 2020 and expanded beyond Southeast Asia before it was terminated in mid-2021, Reuters determined, tailoring the propaganda campaign to local audiences across Central Asia and the Middle East. The Pentagon used a combination of fake social media accounts on multiple platforms to spread fear of China's vaccines among Muslims at a time when the virus was killing tens of thousands of people each day. A key part of the strategy, amplify the disputed contention that, because vaccines sometimes contain pork gelatin, China shots could be considered forbidden under Islamic law. The military program started under former President Donald Trump and continued months into Joe Biden's presidency, Reuters found, even after alarmed social media executives warned the new administration that the Pentagon had been trafficking in COVID misinfor. The U.S. military is prohibited from targeting Americans with propaganda, and Reuters found no evidence the Pentagon's influence operation did so. Spokespeople for Trump and Biden did not respond to requests for comment about the clandestine program. A senior Defense Department official acknowledged the U.S. military engaged in secret propaganda to disparage China's vaccine in the developing world, but the official declined to provide details. A Pentagon spokeswoman said the U.S. military uses a variety of platforms, including social media, to counter those malign influence attacks aimed at the U.S., allies, and partners. She also noted that China had started a disinformation campaign to falsely blame the United States for the spread of COVID-19. In an email, the Chinese Ministry of Foreign Affairs said that it has long maintained the U.S. government manipulates social media and spreads misinformation. Manila's embassy in Washington did not respond to Reuters' inquiries, including whether it had been aware of the Pentagon operation. A spokesperson for the Philippines Department of Health, however, said the findings by Reuters deserve to be investigated and heard by the appropriate authorities of the involved countries. Some aid workers in the Philippines, when told of the U.S. military propaganda effort by Reuters, expressed outrage. Briefed on the Pentagon's secret anti-vax campaign by Reuters, some American public health experts also condemned the program, saying it put civilians in jeopardy for potential geopolitical gain. An operation meant to win hearts and minds endangered lives, they said. I don't think it's defensible, said Daniel Lucy, an infectious disease specialist at Dartmouth's Geisel School of Medicine. I'm extremely dismayed, disappointed, and disillusioned to hear that the U.S. government would do that, said Lucy, a former military physician who assisted in the response to the 2001 anthrax attacks. The effort to stoke fear about Chinese inoculations risked undermining overall public trust in government health initiatives, including U.S.-made vaccines that became available later, Lucy and others said. Although the Chinese vaccines were found to be less effective than the American-led shots by Pfizer and Moderna, all were approved by the World Health Organization. Sinovac did not respond to a Reuters request for comment. Academic research published recently has shown that, when individuals develop skepticism toward a single vaccine, those doubts often lead to uncertainty about other inoculations. Lucy and other health experts say they saw such a scenario play out in Pakistan, where the Central Intelligence Agency used a fake hepatitis vaccination program in Abbottabad as cover to hunt for Osama bin Laden, the terrorist mastermind behind the attacks of September 11, 2001. Discovery of the ruse led to a backlash against an unrelated polio vaccination campaign, including attacks on healthcare workers, contributing to the re-emergence of the deadly disease in the country. It should have been in our interest to get as much vaccine in people's arms as possible, said Greg Treverton, former chairman of the U.S. National Intelligence Council, which coordinates the analysis and strategy of Washington's many spy agencies. What the Pentagon did, Treverton said, crosses a line.